And we're going to send a link later for viewing the video, and we'll post slides and other links on the website. We have a couple of very brief business items. I'm not sure Lori Pross, our treasurer, is on the line. Lori, are you there? Well, I think okay. Dave Prescott is our corresponding secretary. Dave, can you give us your update?
Yes, of course. I'm also the webmaster. As far as the correspondence goes, I'm the one who sends out all the emails. And if there's anybody who would like to add somebody to the list that I should notify, I'll be glad to take it. The easiest way to tell me is to reply to any of the emails I send out. As far as the website goes, I think it's up to date. It shows the ones who have paid the dues for this year. It shows the villages, and also the village directory, I think, is up to date. So if there are any changes, just let me know. Thank you.
Thank you very much, Dave. Okay, moving right along here. Well, I think that a lot of people have been participating in one or more of our, what we call our group mutual support Zoom sessions. And as you've seen, and I can tell you, these are facilitated group discussions, and the participants share problems and solutions, and it's really learning from each other. And we've posted the dates of the sessions that are scheduled over the remainder of the calendar year on the WAVE website under meetings, so you can always go there and see what's coming up. I'm really happy to announce that we're launching the mentorship portion of what we call the mentoring and mutual support program. Carolyn Rourke led a team of board members in developing the program, and we really owe her a huge thank you, and all of them. I think it was Seal, Garrett, and Lori Pross who were also on that committee. And before I turn it over to Carolyn, though, to give you the details, I want to especially encourage all of you who have some village experience under your belts to consider becoming a mentor. We want to hear from people with a whole range of experience to share. It could be on one specific topic or many. It could be on a one-time basis or a more sustained basis. You get to decide how much you can do and when. And you certainly don't need to be an expert on everything. Just tell us what issue or issues you could help others with. Carolyn?
Thank you, Mary Jo. I'm going to share my screen for my slides. Okay, so you should be seeing a slideshow now. There we go. Thank you so much, Mary Jo. It was fun listening to the memories of Miriam before we got started today. I did not know her very well because I'm relatively new to WAVE, but I do know from hearing others talk about her that one of her passions was mentoring. In fact, that mentoring opportunities were a large part of the original rationale for forming WAVE nearly 10 years ago. And there's always been much informal mentoring going on among village colleagues. We're on the phone all the time, back and forth, talking about problems and issues and offering advice and guidance. It's a great thing. This particular initiative is to develop a more formal mentoring program. It began early this spring when Carol Paquette, who is the president of Village to Village Network, and Mary Jo started talking about the opportunities for collaborating and coordinating on mentoring programs. And the program is also meant to coordinate activities between V2V and us and other regional village organizations. And as Mary Jo mentioned at the beginning, the team was comprised of Seal Garrett and Lori Pross and myself. So this portion of WAVE's mentoring and mutual support program is for individual mentoring that will provide focused help on specific needs of individual villages. And we're targeting both operating villages and startup villages. Some of the major categories of topics that we plan to address are organization and management, which could include business plan and model development, budgeting, strategic planning, board composition and recruiting, risk management, which might include insurance or vetting volunteers, technology, which could include website development or scheduling programs, members and volunteers to include recruiting, training, volunteer recognition, activities and programs, which would include member services and educational and social programming, and of course the all-important fundraising, which could include donor cultivation, government support. We do request that for mentoring, if you're an operating village, that you are a WAVE member in good standing, and you can check your membership status on the WAVE website at wavevillages.org. Villages that are just starting up do not need to pay WAVE dues for their first year and can request mentoring during that first year. WAVE members primarily will be providing the mentoring, but we also are thrilled to have a collaborative agreement with Village to Village Network to be able to obtain mentors from that organization if we don't have bench strength in a particular area. So our goal in developing the program is to keep it as simple as possible. You can read about the program online at our website at wavevillages.org about the program and complete a brief online survey of your interests in regards to mentoring in those categories that I mentioned earlier. Once you submit your survey to us, then we will give you a call to make sure that we understand what your requirements are and determine the best mentor fit for you. And then after you're matched with a mentor, it will be up to you to determine the format of your meetings, the time frames, and any other elements that need to be worked out for a successful mentoring session. And as Mary Jane mentioned, you might also be very interested in becoming a mentor. We all have been mentored. When LowLink was being established 7 years ago, we had immeasurable support from already established villages that really helped us get on the right track. And in turn, we have mentored villages that have been coming up behind us. And we all have experience to share. We have backgrounds in organizational management, strategic planning, finance, technology, public health, social services. All those are skill sets that villages need in order to both get established and to be sustained. And of course, as Mary Jane mentioned, mentors determine their own level of contribution. You can contribute 2 hours a month or more, depending upon your time commitments. And of course, mentoring is part of our grassroots culture to help each other out. It's just something that's kind of ingrained in villages to do, and mentoring is a great way to do it. So there, in a nutshell, is our new mentoring program. You can visit us at wavevillages.org or email us at mentor@wavevillages.org. We're so excited to get this kicked off, and we look forward to a very successful mentoring program. Thank you.
Thank you very much, Carolyn. I'd like to take just a moment here to say that I'm sure that many people on this Zoom chat right now have mentored somebody else. I'm sure people have come to you. They've said, how did you do it? What was your problem? We were talking in the social hour just a little bit beforehand about things that we've done differently during COVID. So I really do want to encourage you to consider yourselves as mentors. And even if you know that you can mentor on some things, if your village is experiencing some issues, why, by all means, contact us. We know for a fact that established villages that have been around for a little while, one of the problems they all face is transitions. You know, it's hard. You have the pioneers who have worked so hard and who have given their life's blood to it, and you have to cultivate the next generation. So again, there are a variety of programs, no matter what the age of your village, are going to come up. And there are bound to be others out there who have had the same problems. And even if there is no single best practice for handling that particular problem, why putting a few heads together is going to find a better solution. So please, don't be shy about asking for help of any kind, whether you're a startup, whether you're an experienced village. And please, please, please consider that you do have something to offer. So please go, if nothing else, go and take a look at the mentor form. It may look daunting. All forms look daunting, although thanks to Carolyn, this is really pretty easy. You only fill out a few things at a time. You don't see this, gigantic list there. So please put in your name, even if it's only for one thing, or if you want to make a comment, if you don't see something on there that you might want to share, then there's a place, I believe, Carolyn, at the bottom for even mentors to write in.
Exactly. Mm-hmm.
Exactly. So you can say, well, we really had a heck of a time with this. And boy, I'm quite happy to tell you what we did about it. Okay. So please do go to our mentor page and do that for us. Now I'm going to take just a second because I'm going to move. Oh, no, let's take any questions out there. I don't know, how can people raise their hands and wave their hands, or just unmute yourself and speak up very quickly?
Just to clarify, mentoring is not just for startup villages, correct?
That's right. Yeah, exactly. We're offering.
You look so stylish with your white shorts and your yellow shirt.
Would somebody please mute? Would somebody please mute, or would one of our co-hosts go ahead and vote people?
Thank you.
Good, thank you. Okay.
Yes, to answer the question, there is mentoring is being offered to both established villages and to startup villages. In fact, there are two separate survey forms on the website for that. Thank you. Good question.
And one thing you may find interesting, which I did, is I believe the forms for the startups and also for the more established villages, they list the different village types. V2V Village, and we gave some input to this, has come up with sort of a taxonomy, a way of categorizing different types of villages. And you may not have ever known, well, gee, I'm a neighborhood network village. It's interesting to see the different types and to know that, as you say, you've seen one village and you've seen them all. So I'm going to try and share my screen now as we move on to talk about Miriam Kelty. There we go. Okay, I can't make this fully large because then it takes over all of my screen. So I did want to say that as many of you know, Wade lost one of its co-founders and a very, very dear friend last month. Miriam Kelty had served as Associate Director of the National Institute on Aging, and she was Director of the Institute's Extramural Activities programs. She was a psychologist by training. Because of her passion for healthy aging and her deep attachment to her wonderful community, she created Bannockburn, Neighbors Assisting Neighbors, in 2008 after she retired. When she realized that she was spending a lot of time mentoring startup villages around the region, pardon me, she and two other early village pioneers in the Metro DC area co-founded the Washington Area Villages Exchange in 2010. Miriam was full of energy and a great force for connectedness. She was a mentor and guide to many of us, helping us understand the what, the why, and the how of villages. And she was especially passionate about all volunteer villages like Bannockburn. I'm very happy to say that we will be creating an award in her honor for her invaluable work to promote and sustain villages in the Washington area and nationwide. It will recognize WAVE villages for programs or services that are outstanding examples of villages' contribution to the well-being of people in their communities. Please watch for details, which will be shared in September, and feel free to add your own comments about Miriam in the chat room. Also, if you would like to serve on a committee that finalizes the plans for this award and then helps to implement the award once we launch it, why, please contact me. My information is at the very top of the chat, but I'll repeat it again now, mjd@mjdeering.net. So we'd love to have other people help us out with this effort to honor Miriam. And if there's anyone who would actually like now to say a few words about Miriam, I think we have some time.
This is Sharon and Reston. I mean, Miriam, I would call her first a mensch. I don't know if everybody knows what a mensch is, but it's just a truly fine, caring human being. And she was just very encouraging to me because Reston for a Lifetime is not a traditional village. And she just was very candid in sharing ideas and thoughts and very encouraging. To say what you're doing, it's really a good, it's a service, and nothing is perfect. So don't think that you have to try to be the perfect traditional village to succeed. So I'm just very, very touched by having known her and actually has some time with her. We've turned up at a funeral in Bethesda at one point, and it was wonderful to see her. So she's missed.
Hi, this is Gail Kuttner. And I just want to say that Miriam was like one of the kindest and passionate people that I've known. Personally, she was extremely wonderful and helpful. And she definitely helped mentor our Arlington Neighborhood Village when we started. But she comes off as a business person, but she is the softest marshmallow, and she really moved this whole movement of villages along.
Anyone else? Okay, well, I think as you can all see, why this award will be certainly something that will do great honor to Miriam for all of the work that she did and her vision of what villages are and can be.
Mary Jo, there's someone with their hand up.
Oh, I'm sorry, who's that? Okay, Diane.
Hi, thank you. I just wanted to add, just in the course of adding about Miriam, we live in we're in Cheverly, which is in Prince George's County. It's about as far from where she lives as you can imagine within the metropolitan area. And she didn't think twice about just coming over and initially being part of a little presentation that we organized, which kicked off the village. It was a presentation in our community. And that was back in 2014. And then coming back again to make the presentation that she did at a WAVE meeting on a master aging plan. She did that again for us with the town of Cheverly. So I'm just her generosity, just come on, and she always had time for that, it seemed.
But that's a good reminder that for you who might consider being mentors, and for those of you, especially the startups, who are going to not be shy and ask for help. WAVE does have some resources on its webpage that will give you some helpful information. And I encourage you to, if you're not already a V2V National Village to Village Network member, they have a very, very rich array of resources, including something called Village 101, which they're in the process of updating because there are so many new versions of villages since they last did it. So, and I know that they have special provisions for new startup villages. Maybe somebody could put into the chat room who has that information at hand, but otherwise go to V2V Network, I believe, v2vnetwork.org, and you can check out the membership there and then consider availing yourself of all of those resources. Okay, I guess.
Mary Jo,
yes.
I'd just also like to pay tribute to Miriam. She was an early supporter of our volunteer managed village. And then throughout the years, because I guess I've known her about 12 years, she's at various points been very, very helpful to me, to a group of villages, and just to WAVE. So anyway, I've really appreciated it, getting to know her, and very sad to see her not be here.
Thank you very much. I'm going to turn it over to Erico Kennedy, who's the director of Chevy Chase at Home, and she's going to introduce Professor Lynn Addington, who will talk about a very interesting project that you can all participate in. Erico?
Hello. Okay, Lynn Addington is from American University, and she is a professor in the Department of Justice and Law, and also in the Department of Public Administration and Policy. And she approached WAVE very much interested in looking at what the villages were doing with COVID. Lynn, maybe if you could please step in, thank you, and introduce the study.
Sure. Thanks. I hope everyone can hear me. I've been having a little problems with my Zoom. I think my Zoom's on summer break. So I've been having a few problems with that. So I hope everyone can hear me. But thank you, Erico. And I also want to thank Mary Jo and WAVE for inviting me to today's meeting and giving me this time, and also their support of this project. And especially Erico has been wonderful with her guidance. And also a few of you leaders of the villages have been giving me some inputs. I really appreciate that. As Erico mentioned, I'm a professor at American University. I've been there for about 20 years now, and I'm starting a research project that's looking at ways to provide or improve providing services and support for older adults, especially aging in place. My research background is one of criminology, victimization, and victim services. And so what I've learned from that is that the most successful implementations of support and services aren't ones that are in isolation, but are ones that are integrated into a community and with trusted social networks and community supports. And so as I've been interested in this project with older adults, I wanted to reach out to villages as an important network for older adults. I'm kind of learned about villages because I live in Southwest DC, so I've been following the waterfront village as it started up and all the resources it provides to our neighbors in the Southwest DC community. And also I've been doing my own reading and research so that I knew that the villages were an important concept, an important support group for older adults. So I wanted to become involved and look at this specific project to better understand the current services that villages are providing and also the programs, rather than just kind of from an ivory tower reading about them, but really have an appreciation for how things work in practice, ways to support you all who are involved with villages. I know some are paid staff and leadership, some are volunteer. There's a lot of work that's going on with the villages. So I wanted to better understand that. And I also thought there'd be a good idea to figure out what's been going on with the pandemic, how things have had to pivot, and also perhaps changes or opportunities going forward. So this project is really building on some of the check-ins. Oh, hello? Building on some of the check-ins that WAVE has been doing throughout the past year or so. I know there've been a couple of surveys going on. So this is building on those, looking at the changes that are attributable to the pandemic and health restrictions, the importance of villages in supporting older adults during the pandemic with services, activities, social supports, the idea of the isolation issues that we hear a lot about, and looking at opportunities going forward or identifying those, starting to catalog those in a resource that would be accessible to villages, to WAVE, that these changes would be studied at both the village level and also the member level. So I'd have those two levels of the research. So my goals with this study are really a couple. One is that I want to identify these changes, kind of catalog those. Another important part for me is to bring that information back to you all. I'm a strong believer, if I ask you to spend the time to provide me with information, I want to return that to you. I want to return that information to the community, because it's nice to have in an academic article, but it doesn't really do a lot of usefulness in my view. That's useful in some ways, but really for you all to have it in an accessible format so that information could be used by individual villages and also WAVE as you're looking at perhaps documenting the services you do, if you're looking for support from volunteers for telling prospective members, prospective funders, that you could also use this information to do that. So I wanted to, an important part of this project is for me to bring those results back to you all in a useful format that would be helpful as you are going forward with your work. And so what I'm going to be doing, again, it's the two surveys at the village level and at the member level. And so that's kind of what I'll be doing. I'll be talking about more in the breakout session, is really kind of getting your input about what would be useful, what would be important to collect. I have some kind of ideas right now of what I'm planning to ask, but I'd like to get your input to see if there are things that I'm perhaps missing, and also especially ways of the best practices or suggestions for accessing members in a way that we have good coverage and that sort of thing. So during the breakout session, it's going to be much more of a discussion of looking at these issues and talking to you all. I also appreciate that some of you have, there's a couple other wonderful breakout sessions. So if you can't make mine, please feel free to email me. I'd be happy to follow up with you. And my email is pretty easy to remember. It's adding, it sounds like I'm in the math department. So it's ADDING, adding@american.edu. And I think I can put that in the chat section as well. So if you aren't able to make the breakout session, please feel free to reach out to me. I'd be happy to follow up with you if you've got comments, questions, concerns, or suggestions about the study that I'm doing.
Thank you very much, Lynn. I can see that your breakout session is going to be very interesting. And later, as we approach that time, I will be giving people instructions on how we're going to do those breakout sessions. And thank you for giving your contact information as well. Okay, now I am very pleased now to welcome two senior officials from the Administration for Community Living to talk with us today. We have Rhonda Schwartz and Vicki Gottlich. The Administration for Community Living is in the U.S. Department of Health and Human Services, and it has a mission near and dear to villages to help older people and people with disabilities remain and thrive in their homes and communities. It has 10 regional offices to support state and local activities, and we're in Region 3, and Vicki and Rhonda are from Region 3. It covers the metro area and more. And they're going to tell us about ACL's activities and how the villages can work with its programs. I'm going to introduce both of them now. I don't know which one will go first, but that way I'll have, you'll know a little bit about each of them. So Rhonda Schwartz is the regional, would somebody please mute that person? Thank you. Is the regional administrator for our region. And so she acts as the liaison between the headquarters and all of the activities in this region. I want to emphasize one thing, that her duties include acting as the liaison to the Older Americans Act state and tribal grantees and the area agencies on aging, as well as, and this is especially important to us, developing and fostering partnerships with public and private sector agencies and organizations like ours within the region. Prior to joining ACL, she spent several years managing the Older Americans Act in Rhode Island. She has a BS in Business Administration from Georgetown, so she's a local, and her Juris Doctorate is from Columbia, and she has a social work degree from Rhode Island. Vicki Gottlich is the director of ACL Center for Policy and Evaluation. She also oversees the coordination across ACL to manage the evaluation of and reporting on the performance of ACL programs, and is very cognizant of the issues of measuring performance, success, satisfaction, quality measures. And so we're very pleased that she's going to be able to talk about that aspect of the work. Before joining HHS, she worked as an attorney and a beneficiary advocate for older people and people with disabilities. She also has her JD from New York University, and she has a Master of Laws from George Washington University Law School. So welcome to both of you. I am going to now Rhonda, are you going to go first?
Hi, Mary Jo. Good morning. I will be going first, and we're happy to let you show our slides if you'd like.
Okay, give me one moment while I get your slides up there then.
Okay, thank you.
There they are. Come on. And now I'm going to go full view.
Okay.
There we go. All right.
Excellent.
Ready.
Thank you. Okay, and thank you, Mary Jo, and thank you everyone for allowing ACL to provide this presentation this morning. As Mary Jo mentioned, I am the regional administrator for ACL for Region 3. It can get confusing. Region 3 includes the District of Columbia, Delaware, Maryland, Pennsylvania, Virginia, and West Virginia. I also currently am serving as the interim regional administrator for Region 2, which includes New York, New Jersey, Puerto Rico, and the US Virgin Islands. As Mary Jo mentioned, I'm very fortunate to be joined this morning by Vicki Gottlich. Vicki is ACL's director of the Center for Policy and Evaluation. And in addition to all the great things that Mary Jo told you about Vicki, I want you to know Vicki also serves as a senior policy advisor for ACL, and she oversees the coordination of policy activities across our agency and the review of departmental policies and guidance related to health and human services. I don't know, Vicki, if you're able to unmute yourself real quick, if you want to give a quick greeting before we get started.
Hi, of course, that involves being able to unmute yourself, and we all know that. I'm really happy to participate in this meeting today. I am coming to you from Rockville, Maryland. I am very aware of WAYS and the Villages program, and remember when some of the first villages were started in this area. So it's exciting to participate today.
Thank you, Vicki.
Rhonda and Vicki, before you proceed, I just wanted to let you know that I did create that little poll, which simply asks people how many of them have ever interacted with area agencies on aging in any way. So you let me know if you'd like me to tee it up at the end.
Oh, that would be great. Actually, as we get to the AAA discussion during the presentation, we could bring it up perhaps.
Well, that might, I hope I can do that while I'm sharing my screen without
okay.
You out totally. Well, we'll see.
Whatever's easier for you. Okay. So we're going to start out this morning by giving you an overview of the Older Americans Act. And then Vicki will discuss some initiatives that ACL is working on, and we'll talk a little bit about evaluation. So let's get started. If we can go to the next slide, Mary Jo. Okay. ACL initially was established in 2012 by bringing together the Administration on Aging, the Office on Disability, and the Administration on Developmental Disabilities. ACL was created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their communities. ACL advocates across the federal government for older adults and people with disabilities, and we take a person-centered approach in doing this. ACL believes that everyone has the right to make their own choices and to control their own decisions about their own lives. We further believe that the preferences and needs of older adults and people with disabilities who need assistance should be at the center of the system of services and supports to enable them to live how they choose. Next slide. Now, our portfolio has grown significantly in the years since ACL was established, with the transfer of programs from other agencies to ACL. These additions include a research institute, independent living, assistive technology, and traumatic brain injury programs, paralysis and limb loss resource centers, and programs that help people to navigate their Medicare benefits and the health system. Today, our budget is just over $2 billion. That does not include COVID funding, which I'm going to touch upon a little bit later. There are 65 million people aged 60 and older in the United States. All but a tiny percentage of them live in non-institutional settings, as do nearly 57 million people with disabilities. Both populations are growing, And older Americans are one of the fastest growing demographics in the country, but I'm guessing I don't have to tell this group that. By bringing aging and disability work together, ACL is better able to serve both populations. There are a lot of similarities in the services and supports that the aging and disability populations need in order to live independently. As one agency, we're able to leverage the learnings and best practices for meeting those similar needs. Next slide. So I want to give you a little bit of an idea of how the regions work. As you can see there on that map, we have 10 regions, and you'll see there's region 3, which I'll get to region 3 in a second. But so ACL went through a reorganization back in 2019 that changed how the regions are staffed. And currently each region has one staff person, that would be a regional administrator. And that individual represents ACL in the region and serves as the initial point of contact to ACL for our constituents in the region. The RAs also serve as the liaisons to the state units on aging and to the tribal grantees under the Older Americans Act, providing technical assistance and oversight. So let's dig into the Older Americans Act. Next slide. Okay, so I'm guessing you're all pretty much familiar with the Older Americans Act. These are just some of the areas that we're focusing on. As you can see, we want to make sure people have adequate income, that they are in the best physical and mental health they can be in, that they've got a good system of long-term care services, opportunities for employment if they want to work, educational, recreational opportunities, cultural opportunities. We basically want people to be able to retire in as healthy as they can be with honor and dignity. The Older Americans Act assures that preference will be given to providing services to older people who have the greatest economic need and older people with the greatest social need, with particular attention to low-income older people, including low-income minority older individuals with limited English proficiency, and older individuals residing in rural areas. And another interesting aspect about the Older Americans Act is it does not allow any means testing for Older Americans Act services. Next slide. So here's a quick listing of what we provide, and I'm going to get into a little more detail on the Title III services. But we have Title IIIB supportive services. Title IIIC is our nutrition programs. Title IIID is where we fund our health promotion programs. Title IIIE includes the caregiver support services. Again, I'm going to get into those 5 services or 4 services in more detail. Title IV is where you'll find our training, research, and what we call discretionary programs. Now, the Older Americans Act is a formula grant. It's a mandatory grant program. So it's a federal law, and it requires that funding be provided pursuant to a formula to all state units on aging. So every state has a designated state unit on aging. And for all of the funding under the Older Americans Act, except for some supplemental funding that we provide for nutrition, all of the rest of the funding goes out based on a formula based on the population of older individuals in each state. Title V is where you'll find our employment program funding. And in many states, this is handled by the state labor departments rather than have this program be in the state unit on aging. Title VI is where we provide our funding for Native Alaskans, Native Hawaiians, and Native Americans. And Title VII is where we provide our funding for vulnerable elder rights protection activities. That would include the long-term care ombudsman program, which advocates for the rights of residents of long-term care facilities, as well as funding that we provide to assist states with respect to elder abuse, as well as the state legal assistance development program can be found there. Next slide. So I want to just talk a little bit more detail about Title III. That's where the meat of the services are that would probably be most relevant to the villages. So again, Title IIIB is where we fund supportive services. There's a wide range of services that can be funded with Title IIIB. And what you see here are just some examples: adult day services, homemaker chore services, transportation, case management can be funded with 3B, legal assistance services, Senior center operations can be funded with 3B. You can fund senior center activities, tax consulting services, financial planning services can be funded. So it's a wide array of services that can be funded with 3B.
I've turned on my, that seminar.
Somebody, please mute.
I'm listening.
Oh, okay, I'll go on. Okay, so 3C is probably where our most famous programs can be found. The nutrition programs, the home delivered and congregate meals are funded through 3C. Title 3D is where our disease prevention and health promotion activities can be found. And the Congress, back in 2013, I think it was.
Rhonda, you muted
You're
yourself
mute.
accidentally.
I was just muted. Okay, there we go. I don't know how long I've been muted.
No, not long.
Okay, good. So Title 3D is where you'll find our health promotion activities. And several years ago, I think it was starting back in 2013, Congress required that those programs be evidence-based, which means they're shown by evaluation to be effective. So these programs have to meet criteria that are provided by ACL. Title 3E is where you'll find our family caregiver support services programs. And there are some services that are required to be provided by those programs. And those include information and assistance, counseling support groups, education and training for caregivers, respite services for caregivers, which give caregivers a break, and some supplemental services on a limited basis can be provided, such as meals or if insured drinks, things like that can be provided. So eligibility for all of these programs is generally 60 plus. For 3E, it's a little bit different. So for 3E, it could be any adult 18 or older who's caring for an older adult. Or also that program also can provide assistance for any older relative caregiver who is the primary caregiver of a child or who is the primary caregiver of an adult ages 18 or 59 with a qualifying disability. One just caveat, if it's a primary caregiver of a child under 18, it cannot be the parent. So it can be any other relative or non-relative primary caregiver of a child, as long as it's not the parent. So that's a quick overview of the Title III services. Again, I think those will probably be most relevant to the villages. Next slide. This slide is just giving you just an idea of how the funding flows and how the network works together. So at the top of this pyramid there, you see ACL. And then under that, of course, we have the state units on aging, the area agencies on aging, and the funding, of course, we provide to the tribal organizations and one Native Hawaiian organization. And then there, in turn, the funding will flow from those organizations through to local service providers at the local level. And then that's how you see how we get a wide variety of supports out to folks. So it's a network that has been shown to work pretty well. Next slide. Okay, so, and I apologize if this map is misleading because I've got some Region 2 states in here. So your Region 3 states, and this is showing the area agencies on aging in Region 3. So first, let me mention DC and Delaware. They're both listed on here. And if you notice, they both say 1 next to DC and Delaware. That's because each of those is a single planning and service area, which means they have no AAAs technically. And so the entity that serves as the state unit on aging also is required to comply with all of the functional requirements under the Older Americans Act that would apply to a AAA, which is why you see the number 1 next to each of them, because they essentially are acting as the AAA for their particular location. And then next is Maryland. So we have DC, Delaware, the third state in Region 3 is Maryland. Maryland, it's hard to see that number there, but they have 19 AAAs in Maryland. Next, we have Pennsylvania, which is that large state at the top. Pennsylvania has 52 AAAs. Only one state in the country has more AAAs than Pennsylvania, and that would be New York. So that's a large number of AAAs there. Next, we have Virginia, and Virginia is that block down towards the bottom that has 25. So Virginia has 25 AAAs. And to the left of Virginia is West Virginia, where the number 4 is. Unfortunately, there's a broken line for some reason separating Virginia and West Virginia, but that's where you see West Virginia over on the left with 4 AAAs. So again, for Region 3, we've got DC, Delaware, each with no AAAs. Then we have Maryland, Pennsylvania, Virginia, and West Virginia. So there's a wide variety of area agencies on aging in Region 3. We can go on to the next slide. So let's talk a bit about how Older Americans Act funds are distributed, because I think that will be of interest to all of you. So states that have AAAs are required to distribute their Older Americans Act funds under an intrastate funding formula. And the funds go directly from the State Unit on Aging to the AAAs in their state. Now, these formulas have to be included in their state plan on aging. So if you're ever curious about what a state's funding formula is, you can go to their state plan on aging. They typically are published online. I apologize, I have a dry throat here. So that you'll typically find their state plans online, and the formula is required to be in there. Now, ACL doesn't dictate how these formulas are developed. The state units on aging develop their formulas in collaboration with their AAAs. If they ever want to change or update their formula, they have to do that through a whole public hearing process, so that you all would be able to provide comments and input anytime a state wants to update its formula. And so the Older Americans Act is assuring through these formulas in part that preference will be given to reaching our target populations, which is, as I mentioned earlier, older individuals with the greatest economic need, with the greatest social need, low-income individuals, minority low-income individuals, older individuals with limited English proficiency, older individuals residing in rural areas. So the states come up with their own factors for figuring out how to allocate the funds to the AAAs in their states. And they typically will use US Census data to determine how they're going to give weights to these different elements, characteristics, demographic characteristics of their populations as to how the funding will be distributed in their states. And there also are limitations on services that AAAs can provide directly, because the idea is we want the funding to get out into the community and for local community providers to be providing these services. So we don't want the AAAs to be hanging on to all of this money and doing most of these services themselves directly. So when it comes to all of those supportive services that you can do under 3B and the nutrition services, the congregate and home delivered and the in-home services, in order for a AAA to be able to provide those services directly, they need permission from the State Unit on Aging. And they have to go through a process. It's called obtaining a direct service waiver. And again, there would have to be public hearings, and the AAA would have to demonstrate that retaining the funds and providing those services directly to provide those services would be worthwhile and would meet the criteria for doing that. Otherwise, the AAAs would be contracting out for most of those services. And now AAAs can be different kinds of entities. So they could be part of a local government, or they could be a nonprofit. And so there are going to be different ways that they will be giving out the funds and different requirements that may apply to whether they have to competitively bid, putting funds out or not. So if you're interested, if you want to see if you can maybe contract with a AAA, I encourage you to contact the AAA that serves your region. You can find the AAAs that serve your particular area of your state by going on the State Unit on Aging website for your state. Now, single PSA states, and here in Region 3, that would be DC and Delaware, they are again acting as the AAA. So the same requirements that apply to the AAA would apply to these State Units on Aging. So again, they should not be providing these services that I mentioned, the supportive services and the nutrition services. They should not be providing those directly without having gotten a direct service waiver for themselves. They don't, a single PSA state, because they don't have different AAAs to whom they need to allocate the funds, they don't have to develop intrastate funding formulas, but they do have to have a resource allocation plan that would show they have some plan that helps them to make sure they're getting funds out to the people who are ACL, represent ACL's target populations. And you should see, again, in their state plans that are posted online, information as to how they decide how they're going to distribute their funds. So that's how the funding works. Go on to the next slide, please.
Oh, my screen is frozen.
Oh, that happens. That
My
happens.
screen is frozen. Can someone else? I'm sorry, this happens and then I have to back out and start all over again.
Let's
That
see.
is really unfortunate. Are you able to tee up your slides for just,
Oh, let's, if you, oh, let
I
me,
usually warn people that that happens about once every time, but it's, there we go, there we go.
oh, it just
Bingo.
advanced. Okay. All right. Let me just.
It was enough to
There we
threaten
go.
to shut us off for the technology to behave better. There we go.
Okay, so I want to finish my part of the presentation here by talking a bit about the COVID funding that ACL has given out since the pandemic began. So first we had back in the spring of 2020, I think it was March of 2020, the Families First Coronavirus Response Act, often referred to as FFCRA. You may have heard of it referred to that way. That provided $250 million in additional funding for nutrition services for Older Americans Act programs. So that was our first COVID funding. That was followed not long after by the CARES Act, and CARES stands for the Coronavirus Aid, Relief, and Economic Security Act. That followed just a few weeks after the other funding. Under the CARES Act, about $955 million was provided to grantees in the aging and disability networks. And that included not just SUAs, but also centers for independent living that serve people with disabilities, as well as our tribal grantees. And for example, they included in that 955 million, there was 200 million for home and community-based services under Title 3B. And there was another $480 million for nutrition programs under Title 3C. And under Title 3E received $100 million in funding under the CARES Act. Then we had Supplement 5, appropriations, it was the Appropriations Act of 2021. We think of it as Supplement 5, and that came out around January of this year. And that was another $168 million for nutrition services under Title 3C of the Older Americans Act. And then in the spring of this year, ACL was able to partner with CDC to provide funding from CDC in order to expand access to vaccines for both older adults and people with disabilities. And it was just under $100 million that was awarded. Much of that went to our area agencies on aging to assist with their vaccine efforts. And also some of that funding went to actually help to develop a national hotline for adults with disabilities to help them in finding services, in particular, where they could get access to vaccines. And then finally, in the spring of this year, we had the American Rescue Plan, and that included a very large amount for Older Americans Act programs. That was $1.4 billion allocated for Older Americans Act programs. So we've had very generous funding from the federal government for Older Americans Act programs during the pandemic. And as you can see from the funding I've just spoken about, a very large portion of that was for nutrition, as many of our congregate, or I shouldn't say many, pretty much all of our congregate meal sites closed during the pandemic, and we were able to provide meals for folks at home. So our home delivered nutrition programs exponentially grew during the pandemic, and we have found people who would be eligible on an ongoing basis for this, for home delivered meals, who we just didn't know existed before, in part through this pandemic. So it's been quite an experience for our states and our AAAs. They've all been working really hard. I think it's been just an incredibly overwhelming experience for everyone, but it's been amazing how they all rose to the occasion. And I'm sure you all have too, through your own village networks. And I'm going to pause here. And I don't know if I guess you can't show that poll with the
I think
AAA.
I can. Let's give it a try. So
Okay.
I want to tell people that you're going to see on your screen a very simple question. Have you ever interacted in any way with one of your area agencies on aging? And you just hit the button, yes, no. And I presume we wait, about 30 seconds or so, and then we see what we get. So now I'm going to open up the poll. Hold on, and now I have to launch it. So I'm going to launch the poll. Okay, so if all of you who are on the line now, there you go.
Look at that.
Okay, well, it's only, so we have 8 yeses. 3 said no, so I'm presuming that there are a lot of others who are really a no, but they're not going to bother to fill it in. So I guess it's up to you, Ron.
It wasn't up more than a second. I mean, it was very, very
It's
brief.
still up. Oh, hold on.
The
That's
actual
too bad. I didn't tell it to stop. Let's start again. I'm gonna close the poll and see if I can reopen it. Because I did nothing to, I didn't even touch it. Shoot. Well, I'm sorry, everybody. Well, maybe you want to open it up.
Mary Jo, I have a control on my screen that says I can relaunch it.
Okay, why don't you go ahead and do that, because it won't let
Let's
me.
see if it, let's see. We'll clear exit. Do you want to continue? Yeah, let's see what happens.
There we go.
I feel like
Okay,
I play
better.
that Jeopardy music when they're waiting for people to do their final Jeopardy answer.
Okay, well, that's a good number. Okay, I think we can end the poll now.
Mhm.
So we have 23 yeses and 7 nos. Okay, there we go.
That's not too bad. Well, Vicky and I, we will share our contact information in the chat. Or I can share our contact information in the chat so that folks can certainly reach out to me if they want to talk further about exploring the possibility of connecting with their local AAAs. And at this point, and I want to thank you all for listening to me. And at this point, I would like to turn it over to Vicky.
Thank you, Rhonda. I'm going to talk a little bit about ACL policy priorities, and then I'm going to talk a little bit about some of the program evaluation work that we do, because I know that Mary Jo said that you're pretty interested in evaluating the work that you do. So we want to be able to get you started. We really have 4 policy priorities within ACL. They really reflect this administration's priorities. The highest priority, of course, is COVID-19 response. Rhonda explained the COVID funding. I was really interested to hear Professor Addington's discussion about the survey that she wants to do. We at ACL engaged in some not real formal surveying, but some work to see how the aging communities and the disability communities were responding to COVID vaccine efforts and what was being done to help older people and people with disabilities reach the vaccine. We also tried to get information and some best practices about responding to and getting services for older people and people with disabilities. At the beginning of the pandemic in March 2020, we worked with the long-term care ombudsman programs and with CMS and other entities about assisting people who were in nursing homes and other congregate settings to receive the services that they needed and to allow visitation from family and ombudsman and other visitors. So we've done a lot of work and are continuing to do a lot of work on COVID-19, including looking at long COVID. I'm sure you're all familiar with the phenomenon that there are people who have had COVID and may not even have had serious cases of COVID who are continuing to experience a number of long-term effects from the disease. And what is it that we at ACL can do to help service populations? The next priority is caregiving. As Rhonda said, we provide a lot of funding for programs that provide services to caregivers. I know it's overlaps with some of the work that you do in terms of assisting people, assist other people. We define very broadly. It's not just family caregivers. It's not, it's friends as well. It is families, intentional families. It can be paid caregivers as well. ACL convened the Raise Family Caregiving Advisory Council. Congress designated ACL to gather information on family caregiving as well as grandparents who are supporting grandchildren at this point. The Raise Family Caregiving Advisory Council completed its work. There's a report that is going through review in the Department of Health Services that will go to Congress, and the report includes recommendations for a national strategy to assist caregivers. It's clearly something that you all may want to weigh in on, given the services that you all provide or can provide in your community. Equity is an important issue for this administration. We always laugh because the Older Americans Act was actually written with equity in mind, serving older people with the greatest economic and social needs. We have particular programs for Native Americans, Alaska Native Hawaiians. We have technical assistance center, resource centers that work with African Americans, people of Asian Pacific Islander descent, people of Hispanic descent, lesbian, gay, bisexual, transgender communities. Our equity work is really even much broader than what you see in the Older Americans Act. I want to give you an example of looking at equity. You probably noticed that both Rhonda and I have background screens that say AACL. Rhonda's was the initial one that we developed and that most of us were using until one of our staff members whose staff said that when you have a white screen behind you, it's harder for a deaf person to communicate with their sign language interpreter. And she suggested that we also have screens that are darker backgrounds. So I am trying out our screen with the darker background. It's Lisa, our staff person, says it's helpful to her. And it's a way of pointing out some of the equity work that we do. As Rhonda said, helping people remain in the community is our main goal. It's our name, it's our mission, it's really everything. When you hear about the president's budget plans, about home and community-based services, there's a lot of focus on Medicaid. But Medicaid is not the only approach to keeping people in the community. And we at ACL are working on different approaches as well. That includes different housing approaches. How can we work to ensure that people can live in a community housing setting and receive the supports that we need? How can we ensure that Medicare, for example, helps provide people with the services that they need? I'm sure many of you know that Medicare provides a home health benefit to people who need skilled services. People are homebound. How can we make that service more available to people who are on Medicare and not necessarily on Medicaid? How do we support the direct service professionals who work for individuals who are older and need functional assistance. How do we ensure that there are sufficient people who are trained, who remain in the community and are paid sufficiently to continue to want to do those jobs. And then it's a priority of ours to make sure that the programs we fund achieve their goals through proper performance measurement and evaluation. And I'm going to talk a little bit about that work. So Mary Jo, if you could advance the next slide. Okay. I think I don't have to really describe to all of you the importance of program evaluation. It's really evidence building to answer questions regarding program effectiveness and efficiency. What are the villages doing to make them a really good model for providing services to older people in an environment in which they want to live? What makes them work well? What assistance do they need? How do they achieve what they want to achieve with limited funding? For example, some of you have paid staff, some villages have volunteer staff. What works to promote effective and efficient use of the resources to you? Next slide. So when we define evaluation, we look to a number of keywords. There's systemic, process, information, activities, and effectiveness. How do you use those terms to achieve success? You want your evaluation to be systemic, so it's credible. Does it work for all? Does it work for one system? How does this work over time? Process means that you're going to, again, document the program over time. What works today in Zoom may not necessarily work tomorrow in Zoom. What are the processes that make this more effective? Information is the data that can be used to make decisions. It really helps making decisions, and it is without information, you don't know what's going on. You all know that. Information is like, how many of you have worked with AAAs? That helps us understand how we can help you and evaluate the work you're doing, so help you work more with ACL. Next slide. So this Venn diagram describes different categories of evidence and helps understand a knowledge base for decision making. In the federal government, we have performance management activities that use performance metrics. We have whole government statutes that provide guidelines on how we monitor our grants and how we collect our metrics. The evaluation includes really the designs. What are the questions that we're going to ask? How are we going to figure out what the outcomes are? How do we figure out how the policies affect the outcomes? What's the research that we need to do to show how effective, for example, villages were in addressing the pandemic and many of the issues that came across through the pandemic? And then, of course, there's statistical and data analysis. And what are the surveys that we use? Who are the people that we're serving? What are the services that are being provided? What are the gaps? What's not being provided? What other information we need? And finally, I wanted to put on this slide the evidence building resources that we have developed. We want to ensure that we develop materials not only for our grantees, but for other organizations within the aging and disability communities to help them work on their evaluation and performance management tools, on their strategic planning, on their data quality tools. We hope that we wrote these in plain language and not in government bureaucratese and legalese or in technical evaluation information. I've included the address where you can find these on the ACL website. We hope that they will be helpful to you as you start thinking about evaluation of the work that you do.
Is there, I'm sorry to interrupt, is there a slide about what you were just talking about, Vicki? We're still
Yeah,
looking at the 3 circles.
The 3 circles, we should be on the next slide.
Thanks.
Okay, so the next slide would say evidence building resources.
Yes, that's up now.
Okay, good. Thanks, Wendy. And then if we can go to the next slide, that's just a summary of some of the evaluations that we've done over the past few years. I'd point out to you the caregiver outcome evaluation. I think that that is really useful for you to understand the programs that we fund and that might be relevant to the work that you do. And then our last slide really is our thank you slide. And it has ACL's website. And I think we've left sufficient time for questions. And we're happy to answer questions if we can.
Thank you very much to both of you. That was very, very helpful. And I appreciate having those URLs on the websites where your resources are available. I hope we send a lot of traffic your way. And I hope that what you have told us will encourage more villages to reach out to their area agencies on aging and to see what resources are available to them. And as someone who is an inevitable long-term planner, I always hope that, this is the beginning of a first step toward continually closer collaboration between villages and you. And yes, Carol Paquette is the chair of the board of directors for the National Village to Village Network, and she's overseeing their impact initiative on the component related to data. So, Carol.
I just wanted to ask if we could go back 2 slides to the evaluation. I guess maybe it's 3 slides to the evaluation. Yes, that one. As you noted, for the impact project, we would really like to look at these resources. So, and we got a copy of the slides.
Yes, we'll post a PDF version of the slides on the website afterward.
Okay, thank you.
And Carol, I think Rhonda put our email addresses in the chat. So if you want to shoot me an email, please do. And then we could set up a time to talk. Susan Jenkins is the head of our Office of Performance and Evaluation, and she just loves to talk about it. She'd be really
I will definitely do that. Thank you very much for the invitation.
To talk to whoever wants to talk.
Okay, thanks.
I mean, Vicki, this is Wendy, and I was just going to pick up on that. I think it's an interesting, we've talked about all the work that the villages do, and I know you've mentioned the fact that you're familiar with them, so I won't go through that, but, we've all been incredibly active for many years, but especially this past year, helping older adults, stay safe, get food, go to their medical appointments, and reduce social isolation. And part of the challenge I think we also have is many of us volunteer run, or if not volunteer run, certainly rely heavily on volunteers to achieve our mission. So resources matter. And any amount of resources, additional resources that we could get are going to help us do our job and also expand villages across the country. And again, you know the answer. It's a cost-effective response to keep people safe at home in their communities that they love. So thinking about how we can work with ACL to prove that point, whether that's through evaluation. I understand the idea of each of us going to our AAAs. We have a great relationship with our AAA. It's not a funding relationship, but it's a great relationship. But how do you translate some of that into dollars? And will good evaluation data matter over the long term as we try to translate some of that into financial resources that could help us do our job? So you and Susan would be, a really strong resource for us to tap into.
Yeah, and I've been thinking a lot, and one of the things that we should say is if you go to our website, and Wendy, you know this, but for our others, you can sign up for our ACL's listserv. And as part of the listserv, we send out grant announcements. And it could be that the National Villages Association may want to consider applying for any appropriate grant, where you all think that you might fit in. It's an interesting idea as we think about social isolation. We think about alternatives to institutionalization, as we think about different funding and settings where people live and different ways to provide services.
Yeah, I just think I agree with you. I think there's a real opportunity, and it's going to take years. It's not going to happen tomorrow. But to think about somehow getting into the evaluation framework, I think the work we're going to do with the American University researcher will be a nice first step. But that's in a sense pro bono on her part. So how do we really get something that's a little bit perhaps richer, building on her work? That can, drive home the point of the benefits that come to communities from village services.
Yeah, I agree.
And I'd like to suggest, with the interest in following up and building on this, that you will get a lot of individual requests in your email box. I would like to actually organize a follow-up meeting, because I think rather than cut you into a billion individual responses. Well, we're not billions yet, but So what I would suggest is anyone who would like to have a follow-up discussion with Vicki, you can certainly go ahead and email her, but I hope she'll send it back to me. And you can also email me personally at MJD for Mary Jo Deering, at MJDeering, DEERING.net. And I will try and get together a group of people. And I hope if, you, Carol, representing, V2V, and Barbara, whoever would like to be on it. And we can have a really very robust initial meeting about how we might look forward to a much richer, relationship. I have a specific question, since I actually have never had the need or opportunity or relevance to contact a AAA. You have just described, Vicki, the national grants. Rhonda described the funds that the AAAs have available. Could one of you, in a nutshell, give us a sense of, from the individual of villages perspective, about how to view the difference between those?
I'm going to leave it to Rhonda.
So when it comes to working with, I'm not sure exactly what you're asking, Mary Jo, but when it comes to perhaps working with a AAA, that's probably, I would say, the best avenue for a village to get funding to provide services locally, because the kind of funding that the AAAs are going to have is for exactly the kind of services that I think you would be looking to provide to seniors in your communities. And the way the Older Americans Act is set up, as I mentioned earlier, we're looking for funding to be provided or for services to be provided at the local level by the community organizations that know the people in their community. So that's the whole idea as to how the whole thing is structured. The idea is that it's the providers at the local level that know how best to provide the services and have the cultural competency to serve the members of their community. So I think the best way that a village is going to be able to get get to any funding that might be flowing through ACL would be by looking to the AAAs. And I do want to mention I want to touch on something else. Somebody asked about discretionary grants and the Community Care Corps. Oh yeah, Wendy, that was you. So the discretionary grants, you can always find out about ACL's discretionary grants. If you go to, you can go to ACL's website to the funding opportunity section. And if you periodically go there, you can go there and find out about discretionary grants are grants that ACL issues that are not necessarily, they're not necessarily coming about by legislation and are funded every year. It's grants that ACL may get from one year to the next, and they issue them competitively. That's the main part of it. A discretionary grant is a grant that we award on a competitive basis. And those grants will be posted on our website, and they're open for open competition as long as you meet the eligibility requirements. Typically, at a minimum, you would have to be like an organized legal entity to apply for these grants. And so you can see those from time to time again on our website. You can also sign up on grants.gov, and you can find out about get emails when grants come out that are issued by ACL, so you won't miss a grant opportunity that might come out. But for example, the Community Care Corps that I think you were asking about, Wendy. So that was one grant that ACL awarded. And that's a good example of how sometimes we structure things. So ACL awarded a cooperative agreement to a team of agencies. It's 4 different agencies, and they launched this national program called the Community Care Corps. So ACL's goal is to try to develop like a national volunteer corps. And so the first step in doing this was to issue this one large multi-year grant to this partnership of agencies. And the idea, so they've now developed, they're launching now this national program called the Community Care Corps using ACL's funding. And the idea is they want to foster innovative models in which local volunteers would assist family caregivers, older adults, and people with disabilities with non-medical care in their homes in order to achieve independence. And so the Community Care Corps is awarding grants to local organizations across the country to establish or enhance or grow model volunteer programs. Again, doing simple non-medical tasks, providing companionship or maybe relieving caregivers. They did just have an RFP that was issued, and I believe that the time period to apply for it has expired. It just expired, I think, earlier in July. Does that help understand the Community Care Corps a little bit?
Sure. And this is Wendy. I was asking about it. And you're right. Second competition closed July 9th. I guess I'm interested in, is ACL trying to get more money for that program overall? I didn't see it when you were showing the list of, where your resources go. I didn't notice it as one of the items. And I didn't know whether it had been become part of the administration's request to Congress to continue funding that and perhaps build up the resources that go to that consortium of agencies.
That I don't know about the funding side of that. I mean, again, I think it's a 5-year grant that awarded to these agencies that make up that have developed the Community Care Corps. So they do have this 5-year grant. And as you said, they did just issue this most recent round of funding to fund local projects. I'm not sure exactly how that funding is working year to year, but we certainly, I don't know, Vicki, if you have any more information, or we could certainly look at that and get back to you.
Yeah, because it's the 5-year grant and it's discretionary, I think additional funding was not requested in the upcoming budget cycles because there's still grant dollars and who knows. It's interesting. It's public knowledge. If you look at the budget that came out for next fiscal year, ACL gets additional funding. But who knows if that budget will pass? It's, you know, it's up to Congress. Who knows what they'll ask us to do? You know, again, we just don't know.
This is Mary Jo. It occurs to me that if the period just closed, it will be a short while, but before the recipients are known. And if you could put into the chat room where people could find who won those awards, I think it might be interesting for us to know, because maybe there are some of those organizations that are roughly within our geographic areas. So I think that would be you know, very helpful to know. Thank you. I did want to say, for those of you on the line who think this still all sounds so big, I know of at least one village out in Colorado. The speaker, Hillary Simmons, who spoke to our April program, has started, there was originally a very small village called A Little Help in Colorado, which has now become quite big and very successful. And they actually have a contract with their local AAA to be reimbursed for delivering food to their own members. And so just as a village might normally have this food delivery program up, well, under this contract with AAA, the Colorado village, which is quite dispersed right now and large, you know, submits, I don't know if it's monthly, tallies of the services that it has delivered. Which also then brings us back to that issue of data and evaluation, because it means that the villages need to create more robust, systematic, standardized data collection activities, which I'm sure that will begin to be discussed in Lynn Addington's breakout session. So unless there's any other urgent.
Lorna actually has her hand up.
Oh, yes.
Okay. Yes.
Thank you. I thoroughly enjoy this. It's nice to see the villages on the map, as it were. But aside from the funding, which is critical, I'm wondering, does ACL have any interaction with other organizations? For example, there is a trend now among villages to think about intergenerational programs, even things like playgrounds where you bring together generations together. And then there are also some very critical things that some parts of our area are experiencing: food deserts, or where there's infrastructure lacking to enable people to be out and about. So does ACL have any role with other agencies in exploring other programs or integrating programs across agencies?
Yes, we work on issues, as I said, about grandparents raising grandchildren, but also Generations United. When we think about community living, we really think about the communities. So playgrounds in your neighborhood is bringing the generations together. We work with Department of Housing and Urban Development. We work on food security programs. One of the interesting programs that we're working on is with the FCC on internet access in some communities. So yes, all of those ideas are useful. And again, shoot them my way, because they're the exact kind of things that we're thinking of.
Thank you. Good to know.
Let me get back to this. All right. Well, thank you so much, Rhonda and Vicki. I think that was very, very interesting. And as I say, I hope that we can have a concerted follow-up to this.